and good evening, everyone. Welcome to our webinar on acing internal medicine training in UK and establishing into specialization, arranged by Dream USMLE. This session aims to empower doctors who are caught up in this predicament with knowledge for better career decision that suit their life goal. UK has always been a top priority for Bangladeshi doctors who want to emigrate. I am Dr. Sadia Tasneem, your co-moderator for the session, along with Dr. Promita Das, Dr. Faria Rashid, and Dr. Maisha Anand. Before we start the session, I would like to briefly illuminate on our organization that make this happen. USMLE is a non-profit membership and professional organization governed by founding chairperson Dr. Abdullah Al Masood Sir back in 2015. It serves as a guiding light for Bangladeshi students and medical graduates who aspire to pursue medicine in USA. It offers young physicians workshop in both Bangladesh and US, tailored career webinars for USMLE and other exams as well, special batches for USMLE Step 1, Step 2 CK, OET, Step 3, residency interview skills. This organization also provides US clinical experiences, observership opportunities, research, dedicated mental health support, career counseling webinars to pursue career in US, UK, Canada, and Australia, and overall guidance for fellowship onwards. With a focus on education, health, and human rights, Dream USMLE also plays pivotal role in empowering individuals and addressing both national and global issues. Anyone who have queries about this organization or want to get enrolled in any of the batches, feel absolutely free to contact Dr. Abdullah Al Masood Sir on Facebook or WhatsApp or Telegram as well. He would be delighted to help you out. Also, a quick reminder to our audience, this session is live in both our Facebook group and page. Any queries regarding today's topic, please drop them in the comment box. We will address them during the Q&A session. Without further ado, we now delve into our panel discussion. Today, we proudly introduce our esteemed panelist, Dr. Faisal Abdullah, who graduated from Faridpur Medical College and currently working under NHSC Education Northwest London Hospital as a resident in internal medicine. Along with, he is also pursuing his MSc in internal medicine at University of Edinburgh. He would share now his fascinating journey throughout the years in internal medicine training at NHS. Hello, Dr. Faisal Abdullah. How are you doing?
Hello. Good afternoon. I am doing well. Thank you very much for introducing me.
Now
Do you want me to take over now?
Yours. Please enlighten us with your journey.
Fine. All right. I will share my screen. Please let me know if you can see my screen. Yeah. Can you see my screen now?
Yes, we can see the screen now.
Fine. All right. I will begin now. Thank you very much for inviting me to this session. My name is Faisal. I am an internal medicine trainee in Northwest London. I'm currently placed in the Department of Acute Medicine in St. Mary's Hospital in Paddington, which is under Imperial College Healthcare NHS Trust. At the same time, I'm also pursuing an MSc in internal medicine at the University of Edinburgh. I graduated from Faridpur Medical College in 2019 and did my internship, which finished in 2020. I worked as a clinical fellow in ICDDRB for 1 year before moving to the UK in 2022. Now let's dive into our session. Right. So these are the areas that I will cover today. So I will give a brief overview of internal medicine training. What is internal medicine training? And then I will try to explain in details about how to prepare your CV or portfolio for internal medicine training from now. And then I will give a brief overview of the interview as well. And then I will try to cover some of the most frequently asked questions. And after I have finished my presentation, you will have time to ask me questions if you have any. Right. So first question, what is internal medicine training? So if you want to pursue a medical specialty in the UK, if you want to be a specialist in any of the medical specialty, then you have to go through 2 trainings. The first stage is called the internal medicine training. So when I say medical specialty, these are the specialties I mean. So there are 2 boxes in here, you can see a left one and the right one. So these are the medical specialties. For example, acute internal medicine, cardiology, clinical pharmacology and therapeutics, endocrinology and diabetes mellitus. These are all on the left side, and on the right side there is allergy, audiovascular medicine, aviation and space medicine, clinical genetics, etc. So if you want to be a specialist in any of these, you will have to do internal medicine training. So this is what the training structure looks like in the UK as a doctor. So once you graduate from medical school, first you do the foundation training, which is kind of equivalent to internship that we do in Bangladesh. And then you have to apply for internal medicine training. And then you do the internal medicine training. After internal medicine training, you have to apply again for higher specialty training. After you've finished higher specialty training, then you become a specialist in that particular specialty. This is how it usually works. So today our discussion will be on internal medicine training, which is the training that is after the foundation training and before you can apply for higher specialty training. In fact, completing internal medicine training is one of the criteria for applying to higher specialty training. A bit more details about IMT. So this is a 2-year or 3-year training program. It can be 2 years for some people. It can be 3 years for some people. So if you want to pursue a group 2 specialty, you'll have to do 2 years of internal medicine training. If you want to pursue a group 1 specialty, you will have to do internal medicine training for 3 years. So what do I mean by the group 1 and group 2 specialties? I'm just going to go back to the previous slide and the one before that. So here, as you've seen, I have divided the medical specialties into 2 halves. The left one are the group 1 specialties. So if you want to be a cardiologist, then you have to do internal medicine training for 3 years. Okay, any specialty in the left-hand side, if you want to pursue that, you'll have to do internal medicine training for 3 years. If you want to specialize in any of the group 2 specialties, you can do internal medicine training for 2 years. That should be fine. So back to the internal medicine training again. So it can be 2 to 3 years, depending on what specialty you want to pursue. This is a rotational program, which means you work in different departments. You can work in cardiology, respiratory medicine, geriatrics, etc. And each rotation can last for 3 to 6 months. There are some rotations that are mandatory. For example, in ITU or ICU and geriatric medicine, these are 2 mandatory rotations that you must do during IMT. In the first 2 years of the training, you work as an SHO, which stands for a senior health officer, which is equivalent to working as a medical officer in Bangladesh, as in this is a junior role, what they call a resident doctor. And then in the 3rd year of the IMT, you work as a registrar, which means you are a middle grade doctor at that time, okay? And the membership exam, MRCP, membership of the Royal College of Physicians of the UK, must be completed within the first 2 years, which means before you become a registrar, you have to complete MRCP. At the same time, you have to meet the requirements of the training itself as well. So when I say requirements of the training, it encompasses a lot of things, one of which is workplace-based assessments. So throughout your training program, you are assessed by your consultants by different assessment methods. These are called workplace-based assessments. And there are a number of tick boxes that you have to fill in. For example, you have to achieve competencies in different procedures and you have to get things signed off by the consultants. So you have to have MRCP and you have to have met the training requirements as well. That's the summary. And after you complete internal medicine training, you become eligible to apply for higher specialty training in a medical specialty. You do not become a specialist of internal medicine after completion of internal medicine training. You cannot work as a consultant anywhere after finishing internal medicine training in the UK. This is very unlike the residency training program in the US, where internal medicine itself is a specialty that you can specialize in, which is different in the UK. Here, internal medicine is not a separate specialty. Okay, you cannot be a consultant of internal medicine. Right. Here is a bit more information on the group 1 and the group 2 specialties. So if you decide to pursue a group 1 specialty after you have finished internal medicine training and higher specialty training in that specialty, you achieve dual specialization. What does that mean? Let's say you have done internal medicine training for 3 years, and then you have done acute internal medicine training, higher specialty training, which means after completion of all this, you will be an acute and general internal medicine specialist. Okay. For example, you have done a internal medicine training for 3 years, and then you have done cardiology higher specialty training, which means after completion of both of these training, you will be a cardiology and general internal medicine specialist. This is an extra benefit that comes with the group 1 specialties. Okay, so you'll be a general internal medicine specialist on top of whatever your mother specialty is. However, for group 2 specialties, you do not achieve dual specialization. For example, if you train in hematology, you will be a hematology consultant. You will not be a hematology and general internal medicine specialist. So at this stage, you might have some questions, and I will try to cover those questions. One of which is, will I be paid during the training? Yes, you will be paid. This is a paid training program. You will be paid during this training. How much is the payment? So this is on paper. As an internal medicine trainee first year and second year resident, your basic pay will be £49,900 annually. And as an internal medicine trainee year 3 resident, you will earn £61,825 annually. Again, this is the basic pay. Tax would be deducted from this. You will have to pay for national insurance from this, and you will get some other payments as well based on whatever rotations you have and whatever working hours you're having. For example, if you work a lot of out of hours, then you'll have a lot of extra payment on top of it. But this is the on paper basic. Another common question is, do I need to have work permit or visa to apply for IMT? No, you do not need to have work permit or visa to apply for IMT. Theoretically, you can apply for internal medicine training while you are in Bangladesh, theoretically, okay? And once you get the training number, if you need visa, you will get a visa for 3 years. You'll get a skilled worker visa for 3 years. You'll get a certificate of sponsorship that you can use to apply for a skilled worker visa for the duration of your internal medicine training. Will I be able to bring my wife or children with me during the training? Yes, you can. Will I be able to bring my parents with me during the training? So your parents can visit you as a visitor. They will not be a dependent of yours. They can't be a dependent. They can come and visit you as a visitor. There is a specific time limit as in how long they can stay with you in the UK. Can I go and visit home during the training? Yes, you can. You will have 28 days of annual leave every year as a trainee. So you can organize your leaves and you can do whatever you want during the training, during your leaves. Now let's move on to the next section, which is preparing to apply for IMT. So this section is specifically meant for doctors who are planning to apply for internal medicine training at some point in life. If you are currently working in the NHS, you will be benefited from this conversation. If you are not currently working in the NHS, if you're in Bangladesh or somewhere else and you're planning to come to the UK and to apply for internal medicine training at some point, this will be an eye-opener for you. Right. So what are the requirements? What do you need to apply for internal medicine training? The first thing that you need is foundation competency. So the doctors who graduate in the UK, they undergo 2 years of foundation training. And after 2 years of training, they achieve a foundation competency. As international medical graduates, particularly from Bangladesh, we do not have a foundation program. We have an internship which runs for 1 year compared to the 2-year foundation training in the UK, right? So an international medical graduate has to achieve a foundation competency when he's applying for internal medicine training. So this is called the CREST form. I will talk a bit more about the CREST form in the next slide, but just bear in mind that you need to have a CREST form signed in order to apply for internal medicine training. Second is experience. How much clinical experience do you need to apply for IMT? So the rule is you'll have to have 24 months of clinical experience before the start date of IMT. That's the rule. And you need to have GMC registration before the start date of IMT. So just bear in mind, the experience rule and the GMC registration rule is not when you apply for IMT. This is meant for when you start working as an internal medicine trainee, right? Now, what is the CREST form? So CREST stands for Certificate of Readiness to Enter the Specialty Training. So someone has to certify you saying that you are ready to enter the specialty training in the UK. So if you go to this link, you will find a form and someone needs to fill this up. So who can sign off a CREST form? So it has to be a consultant or a specialist who has worked with you for a minimum of 3 continuous months in the last 3.5 years. And they have to sign you off for every specific point that is mentioned in the request form. That's basically request form. At this point, we have some questions. Number one, can I get the request form signed by a consultant from Bangladesh? Theoretically, you can. If you are still working in Bangladesh, you don't have any other way to get it signed. So yes, you can get it signed by a consultant from Bangladesh. However, if you are currently working in the UK in the NHS, you should try to get it signed by a consultant in the UK. It's not a mandatory thing, but it is mentioned in the website itself that if you have worked in the UK in the past 3.5 years for 3 or more months in an acute post, you should use a signatory from that post rather than an overseas signatory to complete your request form. I would suggest if you have a request form that is signed by a consultant from Bangladesh, that is fine, but keep it as a backup. Try to get it signed by a consultant in the UK. Another question, nobody in my hospital is agreed to sign my request form. Should I get it signed by a consultant from Bangladesh then? You can do that, but if no one is agreeing to sign your request form, that you should probably try to find out why they don't want to sign you off and work on that, okay? And at that point, you should start maintaining the Horus e-portfolio to keep objective evidence of competency achievement. You will understand what all this means when you go through the request form itself. Now, what's the process? How does it happen? Okay, so at some point, the advertisement will be published that we are recruiting for internal medicine training now. And then you'll have to apply for that post. The second step is the long listing, which means they are going to review your applications and check if you meet the minimum requirements. For example, they will check your CREST form, they will check the level of experience you have, etc., and say if this is okay. The third step is shortlisting, which means they're going to review your application, not just your application, like everyone's application, and then decide who are the candidates they will invite for interviews. Okay. And based on your application, based on how good your profile is, they will invite you for interview, and then you will attend the interview. Then they will publish a national ranking. For example, if 4,000 candidates attend the interview, they will publish a ranking of 4,000 doctors starting from number 1 until like 4,000. And then they will allow you to put your preferences, as in where do you want to work as internal medicine training. And then you will be matched based on the ranking that you have achieved and based on the preferences that you have put. And then you will be offered. This is like a bird's eye view of how the process works. The most important bit here is the shortlisting bit, which means developing your CV or your application. Okay, so this is an overview of the time frame when it exactly happens. So all the job adverts are in the Oriel website, oriel.nhs.uk, and this is the time frame from this year. For example, the job advert was the vacancies were published on 23rd of October 2024. Then applications opened on 24th of October. And you had 1 month to apply for the posts. And it took 1 month for them to long list. And then shortlisting was done by 18th of December. Then interviews started on 13th of January, and it's still ongoing. And the rankings would be published on 25th of February. Okay, and the training post is going to start on the first Wednesday of August. So this means if you want to apply for internal medicine training in this October, then the training post is going to start on 2026. Okay, so it's like a 8 to 9 months long process. So you'll have to bear this in mind, and you'll have to have everything ready by the time you apply. So all the things that you want to do for your CVs and stuff, you have to make things ready by the last week of October, because that's when the application starts. Right. So I said before that you'll have to have a good CV. What does that mean? So when you apply for the training program, there is a self-assessment score. So there are some set criteria, and you have to score yourself based on that criteria and see how much score you achieve. And every applicant who's applying for the training program will score themselves, and this will be assessed nationally. And based on that, they will let you know if you're eligible for the interview or not. So these are the categories. One is postgraduate qualifications. Second is presentations. Third is publications. Fourth, teaching experience. Fifth, training in teaching. And sixth, quality improvement. We will dive deep into each of these, okay? So, qualification. I'm not sure if you can see the screen here. This is the font is very small. Anyways, so if you have a PhD or an MD by research degree, you can claim 4 points for that. If you have a master's degree, an MSc, an MA, or an MRes, you can claim 3 points for that. If you have any other postgraduate degree that is not a PhD, not a master's, you can claim 1 point for that. However, membership examinations postgraduate examinations, you cannot claim any points for them. For example, if you have done MRCP, you cannot claim points for that. If you have done FCPS in Bangladesh, you cannot claim points for that, right? So frequently asked questions. Do I need MRCP Part 1 to get into IMT? It's good if you have it. It's okay if you don't. It's not a self-assessment criteria. You cannot claim points based on MRCP Part 1. So if you have done MRCP Part 1, it shows commitment that you really want to do internal medicine training, but it's not a mandatory thing. For example, when I applied for internal medicine training, I didn't have MRCP, okay? So it's okay if you don't have it, but it's good if you have it. If you have time, yes, go for it. Someone told me they did not get an IMT position because they did not have MRCP. Is that true? Probably not, okay? Because you don't need that. It's not a mandatory thing. Can I claim points for CCD, CMU, DMU? So certificate course on diabetology, certificate course on medical ultrasound, and diploma in medical ultrasound. So the website does not actually specify if you can claim points for CCD, CMU, or DMU. You probably can, but you should clarify this with the website, as in you should get in touch with the team and then clarify if you can claim points for that. Okay, but I would not be very certain that I will claim points for that. Clarify with them, and if they're happy, yes, claim. Okay. Can I claim points for FCPS MD degree in Bangladesh? No, you cannot. I have recently started to work in the NHS, or I will start working in the NHS soon. What can I do to make sure that I have a qualification to claim point by the time I apply for training? Right. So if you have had a look at the qualifications, you can see that all of the qualifications here take time. So if you want to do a PhD or MD, it's going to take like 3 to 4 years to do that. So if you have just started to work in the NHS, you cannot do a PhD by next year. So no, you can't do that. Masters is still the same. It takes a time for you to do a master's. However, if you want to do a postgraduate certificate course, that is something you can possibly finish in 8 to 9 to 10 months. So if you really need the point, you can do that. But bear in mind, it's very expensive and you'll have to pay the expenses by yourself unless you manage to have a scholarship or something. Another question, I am a medical student or intern now. What can I do to make sure I have some extra qualification to claim point by the time I apply for training? I don't think there is anything that you can do at the moment. What you can do is when you're in Bangladesh, you can probably try to do a CCD or CME or whatever and see if that helps. I don't really know if you can claim points by that, but if you can, you maybe can claim 1 point by that. Something to think about. So that's all about the qualification. Second criteria in the self-assessment form is presentation. If you have an oral presentation in which you were a first or second author, and that was given in a national or international medical meeting, you can claim 6 points for that. If you were the first or second author in a poster presentation in a national or international meeting, you can claim 4 points for that. An oral presentation where you are the first or second author in a regional medical meeting, you can claim 3 points for that. Oral presentation in a local medical meeting, you can claim 2 points for that. Poster presentation in a regional or local meeting, you can claim 2 points. Okay. And if there's something that does not actually fill the criteria that I've just mentioned, you can't claim points, but you can still mention it in the application. Frequently asked questions. Can I claim points for a presentation that was done in medical college or internship? So this is what the website says. Whether it is a presentation or a poster, your achievement should include delivery of novel data, for example, research, a complex clinical case, or a quality improvement project. This section should not include presentations primarily aimed at teaching. So whatever presentation you did during your medical school or internship, if it's not a research, if it's not a quality improvement project, then it's very unlikely that you should be able to claim points for that. So in internship, we usually do teaching presentations, for example, grand rounds and stuff. So you present a case and you do some teaching. So no, you cannot claim points based on that. Okay. So I've already answered this. You cannot claim points. Where can I learn about conferences? I will talk about that in details in the later part of this presentation. I've recently started to work in the NHS. What can I do now? I'm a medical student. What can I do now? Again, I will cover this in the later part. Let's skip this for now. Third criteria is publication. I am the first author, joint first author, or corresponding author of one or more PubMed-cited original research publication. You can claim 8 points for that. If you're a co-author of one or more PubMed-cited original research publication, you can claim 6 points. Then first author, joint first author, corresponding author of more than one PubMed-cited other publications, such as editorials, reviews, case reports, letters, etc. You can claim 5 points for that. If you have written a book chapter, you can claim 5 points for that. If you have done PubMed-cited other publications, such as editorials, reviews, case reports, letters, etc., you can claim 3 points for that. And if you've written abstracts, if you have published abstracts and non-peer-reviewed articles or published articles that are not PubMed-cited, you can claim 1 point for that. Frequent asked questions. I don't have a publication. What can I do? So you have to start working on it so that you can have a publication. That's the easy answer, but the job itself is difficult. We will talk a bit more about this later on. I don't have a publication. Will I get into IMT? So publication itself is not a parameter of IMT application. The overall application is assessed. So if you have more points in other parts of the application, then yes, you may. But because you don't have a publication, it does not mean that you will not get an IMT position. You can still get an IMT position if you have scored enough in the other categories of the self-assessment score. Can I claim points for RFST? You cannot. So if it is a publication, if this was published somewhere, yes, you can. If it has not been published somewhere, when I say publishing, I mean a journal, not publishing from a publishing house or something. Okay, so if it has been published from a journal, then yes, you can claim points based on whatever category this is. Otherwise, you cannot. I am a medical student now. What can I do to make sure I have a publication by the time I apply for training? And I have recently started to work in the NHS, or I will start working in the NHS soon. What can I do to make sure I have a publication to claim points by the time I apply for training? So this part is a bit difficult because as a medical graduate from Bangladesh, we don't necessarily have enough skills to contribute in the field of research. Okay, so the best thing that you can do to help yourself is to find out consultants in your hospitals who are involved in research and talk to them. Okay, let them know that you're interested to work in research and get some papers and see if they can help. You should be able to find someone if you search well enough. So try to find people, talk to them. Find out registrars who are involved in research and talk to them, particularly people who are doing a PhD or who are in the NIHR academic fellowship. They have a lot of research projects going on. So they need a lot of people to collect some data and stuff. So you can talk to them and you may be able to find a project from them. But bear in mind, this takes a very long time to finish. So try to get as much as possible. Okay, and make yourself valuable, develop skills that you can offer. You can consider to attend some courses and see if you can develop some courses. And when you talk to the consultant, you can say, well, I can do data analysis, I can do SPSS, I can do R, etc. So if you have anything, please let me know. Another common question is, if I do a course on publication or research, can I claim point for that? No, you cannot claim point for a course that you have done on research or publication. Next category is teaching. So if you have worked to organize a teaching program, which means a series of sessions for healthcare professionals or medical students, where you're regularly taught approximately for 3 months or longer, and you have evidence of formal feedback, you can claim 5 points for that. If you have provided regular teaching for healthcare professionals or medical students, where you haven't actually organized the teaching, but you've just taught, then you can claim 3 points for that. And if you have irregularly taught medical students occasionally, then you can claim 1 point for that. The important bit here is you have to have evidence of formal feedback. What does formal feedback means? Formal feedback means you need to have feedback from 2 different sources. So it's described here, if you can have a look. You have evidence of formal feedback from these sessions or a developing the clinical teacher / teaching observation form. So you need to have feedback from the students, and you need to have feedback from a consultant or someone senior to you who is going to fill up this teaching observation form and say what you did well, what you did not do well, etc. Have a look at the form and see what this means. Okay. Having feedback does not mean someone saying you did well. It needs to be a documented written piece of evidence, both from the students and from the teachers. Frequently asked questions. I was a lecturer in a medical college or a nursing college in Bangladesh. Can I claim points for that? If you have evidence of what you have done, you can. So have a look at the criteria. Do you fit into any of these? If yes, then you can. If you have evidence of feedback, if you have a proof, then yes, you can. When I say proof, it means a certificate saying that you have done these, which clarifies what your role was. And if you have evidence of feedback, then yes, you can claim points for that. I used to be a private tutor in medical college or before medical college. Can I claim points for that? Probably not, because you don't have feedback and you don't have any teaching observations form done. So no, you can't do that. How can I get feedback? So you need to have feedback from students and teachers. So you need to have a form, and after you teach something, you'll give the form to the student and ask them to fill it up for you. It can be a paper form. It can be like a link, Google Form links as well. Either works fine. And it is the same for the teachers. You use a teaching observations form. You ask one of the consultants that you're going to do a teaching session, and you ask them if they can fill it up for you. And that's it. What sort of evidence do I need for the teaching? I've just mentioned you need a certificate and you need proof of evidence. I have recently started to work in the NHS, or will start working in the NHS soon. What can I do to make sure I have teaching experience? So the best thing that you can do to help yourself is contact the postgraduate medical education department of your hospital. Send them an email, say that I'm a doctor, I am working as an FY2, FY3, whatever, and I want to organize a teaching program for the medical students for my portfolio. Can you please introduce me to the medical students so that I can organize a session? So you make a plan, you say it to the medical education team, and they will help you. This is how it happens in everywhere. Another thing that you can probably do is you can get in touch with the unit training lead of your hospital, of your department. So every department has a unit training lead, and sometimes there is a registrar who organizes the teachings and stuff. So you can also talk to them and let them know that you want to organize a teaching session for getting portfolio stuff, and they should be able to help. You can also contact the clinical teaching fellows. Every hospital has got some clinical teaching fellows, and they might be able to help you as well. I am a medical student now. What can I do to make sure I have a publication by the time I apply for training? So when you are a medical student, you probably don't have much opportunity, but when you are an intern, you can do a lot of stuff. So get in touch with one of your registrars or one of your consultants and say that this is what you want to do. You want to take some sessions and stuff for third year medical students, And if you continue that for like 3 months, and if you take feedback from the students and from the consultants and keep it until you come here and apply for internal medicine training, you should be able to claim points by that. Okay. And a difficulty that most people face from Bangladesh is a lot of these things are not very common in Bangladesh. So you have to be the pioneer. You have to talk to the people and you have to say that this is what I want to do. This is why I want to do it. And then just get it done. Okay. That's teaching. Another category is training in teaching. If you have a higher qualification in teaching, for example, a PG cert, a PG diploma, or a master's or whatever, you can score 3 in here. If you have a training in teaching, which is below the level of a PG cert or PG dip, then you can claim 1 points for that. Frequently asked questions. What sort of courses you should do? There are a lot of teaching courses out there, both online and offline. I have here given some examples. For example, there is a Teach the Teacher course, which is very famous from Oxford Medical and Organization. You can do that. There is a Teach the Teacher course, which is organized by Royal College of Physicians of London. You can do that. Training the Clinical Trainer, which is organized by RCP Glasgow. You can do that. There is a Train the Healthcare Trainer, which is organized by the e-learning for healthcare. We can also find this in FutureLearn. You can do all those things. Are these courses free? No, these are all paid courses. The last one, Train the Healthcare Trainer, this is free for NHS workers. I have recently started to work in the NHS or will start working in the NHS soon. What can I do? So just do a course. That's the best thing. It's a 1 or 2 day course. It does not take, it's not difficult to get this course done. Whenever you're available, just do this course and you'll be able to claim 1 points at least. However, if you want to claim more points, then you should plan to do a PG cert at least, and that you can claim 3 points for. But bear in mind, it is going to be expensive and you have to spend a substantial amount of time for that. Quality improvement. This is another assessment criteria. So if you have been involved in all stages of 2 cycles of a quality improvement project, you can claim 4 points for that. If you have been involved in some stages of 2 cycles of a quality improvement project or all stages of a single cycle of a quality improvement project, then you can claim 3 points for that. However, if you have involved in some stages of a single cycle of a quality improvement project, you can claim 1 points for that. Now, what is a quality improvement project? So a quality improvement project is basically a project that you do to improve the quality of a practice. Let me explain. For example, we have all read in the books that when you have a patient with pneumonia, you should do the CARP 65 score, CURP 65 score, okay? So you can assess if people are doing that in your hospital and try to do something to improve the practice, okay? Let's say you have collected some data for 7 days, okay? So, or let's say 1 month, whatever, and see how many patients were diagnosed with pneumonia during that 1 month period. And you see how many patients had the CARP 65 score documented in the patient's notes, and you find out something, okay? This is called first cycle of the audit. So you have selected a standard, as in you are going to assess if CARP 65 score is documented, that's the standard. And then you have collected data of 1 month and you have found the number of how many patients this has been documented or not. This is the first cycle of the audit of the quality improvement project. This is also called an audit. And then you do something to improve this practice. So let's say you have organized a teaching session for everyone, for the doctors, for the nurses, etc., where you have explained the findings of your audit and you have told them that actually you should do that because this is what the guidelines says you should all do that. And let's say you have done some postering in the departments as well, that we've done an audit, we've found that people are not documenting the CAP 65 score, you should do that, etc. And after this is the intervention, after you have done the intervention, you do another cycle of the audit. So you collect data again for 1 month and see what's the improvement after you have implemented the change. Okay, and then you'll probably see there is an improvement, and this is what a quality improvement project is. To explain easily. Now, where to look for topics? You can just search in Google and find a lot of topics, okay? I'll talk a bit more about the topics later on. Who should I contact to get a quality improvement project? So if you are working in the NHS, then the first person of contact should be your supervisor, your clinical or your educational supervisors. Talk to them and say that you want to do a QI, and they should be able to give you a project that you can work on. And then you can also talk to registrars and see if they're doing something and you can help them. Okay, and then you can get your name into a project by that. And if you haven't managed to find any from your supervisor or the registrars, there is an audit department in each hospital. It might be a good idea to talk to them and see if there's anything that they want you to do. There is a governance lead of the hospitals as well, so you can talk to the governance lead as well, and you'll be able to find projects. And the easy way is to do something that someone has already done. You don't need to do a project that is novel, that no one has ever done. No, you can do something that has been done before. That's fine. So find out what has been done before, and you can just do another cycle of that audit. Okay. And if you attend a lot of conferences, in conferences, there are usually quality improvement project competitions. So you will see a lot of QI projects that other people have done, and you can get idea from there as well. In my hospital or trust, nobody cares about quality improvement projects. What can I do? If you are working in the UK, this is not right. This is probably, you probably haven't searched enough. So just talk to the right person and they should be able to help. How can I do a quality improvement project in Bangladesh? So as I have told before, there are things that are not quite familiar in Bangladesh. So you have to be the pioneer. You have to go and talk to the bosses and tell them that this is what you want to do and why you want to do that. And if they're sensible enough, they should help you with that. Okay. All you need is the project. You have to do the project and you have to have an evidence. You need to have a certificate and you need to have like a poster or something that you can show as an evidence that you have done this. Okay. My senior will not let me do a quality improvement project in Bangladesh. What can I do? You probably cannot do anything about that. So maybe try to do something when you come to the UK. Can I do a quality improvement project in a hospital where I don't work? Practically, no, you cannot, because you're not working there, so you will not be able to access their data, their information, etc. So you can't do that. Do I need to present the project to claim points? No. So if you want to claim points for a quality improvement project, you do not need to have presented this. If you have presented it as well, you can claim points in the presentation category as well. There is a clever trick here, which I'll tell you shortly. I have recently started to work and I am a medical student now. What should I do? I'll talk about this later on. Now, common QI ideas. So the best thing to do is to search in Google. For example, you're working in acute medicine now. Search in Google audit ideas for acute medicine, quality improvement ideas for acute medicine. You'll find some, okay? The other way is to attend conferences. The way to find conferences is to look into the Royal College websites. So there are 3 Royal Colleges, Royal College of Physicians of London, Glasgow, and Edinburgh. So every Royal College has an events page And if you go to the events page, you will see what are the upcoming conferences. So if you attend one of these conferences, usually there is abstract presentation in the conferences where people present their audits and quality improvement projects and researches. So if you attend those conferences, then you will get a lot of ideas of what are the things that can be done, okay? And you will be able to do those things in your hospital as well. Another way is to attend conferences of different societies. For example, Society of Acute Medicine, European Society of Cardiology. So if you're interested in a particular specialty, for example, if you're interested in gastroenterology, so you can attend a gastroenterology conference, Society of Gastroenterologists, and you will find ideas of QIs and stuff. And these are some of the very common audit ideas or QI ideas. One is VTE prophylaxis, venous thromboembolism prophylaxis, oxygen prescription, DNA CPR documentation, smoking cessation services, advanced care planning in geriatric population, CARB 65 score documentation that I've just given an example of. The QI does not need to be novel or something new, okay? Anything, whatever the topic is, you can claim points for that. It does not need to be clever. So, that's all about our self-scoring criteria. So I have tried to explain what the self-scoring criteria are and how you can claim points. So postgraduate qualification, presentation, publication, teaching experience, training in teaching, and QI. Okay, now let's move on to the next part, which is a quick look at the timeline. So people who have applied for internal medicine training last year, the applications opened in end of October, and they had 1 month to submit their applications. So if you want to apply for internal medicine training this year, as in the applications will open in end of October, okay? So you will have to have all your achievements ready by this time, okay? So end of October is the time frame you should look for, and you should aim to get everything sorted by that time. How much self-assessment score do I need? So bear in mind that the self-assessment criteria changes every year. I applied for the internal medicine training in 2023. Then they had another criteria called leadership and additional qualifications, but they have got rid of it now. And they are probably going to change it even further next year. So bear in mind that it's going to change. But this is the data from this year. The maximum points could have been 30, and the mean and median average was 13.75 and 14. You can see that 15 is probably kind of the peak here, okay? So you should aim to achieve as much points as you can so that you are in a safe range. And I can guarantee you 16 can be achieved very easily. It just requires time, patience, and some planning. How? So if you do a quality improvement project, you will gain maximum points. If you do a 2-cycle quality improvement project, you will get maximum points in that, which is 4. And doing a quality improvement project is not difficult. It's very easy. It just takes some time and some planning, okay? So talk to someone today. If you haven't done anything, email your supervisor on Monday morning and say that you want to do a QI project and get a QI, get it done, get 2 cycles done very quickly, okay? And then you have 4 points. After you have finished doing your QI, present that same QI in an international conference, okay? Find out a conference, go to the Royal College websites. So the RCP London website, there's an upcoming RCP London conference soon, like a lot of conferences, but there's one I am aware of. There are RCP Glasgow conferences, RCP Edinburgh conferences. There are conferences of specific societies as well. So if you present the same QI in a conference, As an oral presentation, you will get 6 points for that. That's 10 points. So you do a QI and you get 10 points out of that. Then if you attend a teaching course, like a 2-day teaching course or a 1-day teaching course, you will get 1 point. Okay, so I've mentioned some of the courses. You can explore more and find out which one you want to do and see when's the next date. Apply for a study leave, do the course, and you have 1 point there. And then if you organize the teaching program, you'll get 5 points. So this is going to take time. So as you understand, if you want to achieve the maximum points, the teaching program needs to run for 3 months. Okay, so email the postgraduate education team on Monday and say that you want to organize a teaching program for the third-year medical students, etc., and start working on it and continue it for 3 months. You don't have to do it every day. Okay, you can take like 1 session every week, you can take 2 sessions every month, whatever you want. Okay, you can recruit teachers as well. You can take some sessions. You can ask one of your other colleagues to take some session. You can ask one of your registrars to take some session. It's all about organizing where you are teaching as well. And if you do that for 3 months, you will have 5 points. So 16 points, you can easily get them just by being a bit patient and just by doing some planning ahead. But bear in mind that the self-assessment criteria changes every year. So it's probably going to change. Okay. If you cannot do any of these, for example, you couldn't manage to do something, then it's a bit tricky. Okay. Because as you have seen, the mean score was like 15. Okay. So it's a bit tricky. You should definitely try to hit 15 or 16. The difficult part is publication. There is no straightforward way of getting a publication out of nowhere. Okay, so you should try to talk to people and try to see if they can find you a research project where you can contribute and try to get a paper out of that. But it takes time. So no one can guarantee you that if you start working on a project today, you will have a publication by end of November, end of October. No one can guarantee that. But the teaching and the public and the presentation and the QI, you can definitely get these things done by like 4 or 5 months. Okay. And if you think you need more points, you can consider doing a PG cert in medical education, because if you do a PG cert in medical education, you'll get 3 points. Okay. So that's going to add up to the points. Also, bear in mind, you cannot claim points in 2 different categories in one heading. For example, you have done an oral presentation. You also have done a poster presentation. So can you score 6 plus 5? No, you cannot. You can only claim 1 points for each category. Okay. I will move on to the next part, which is the frequently asked questions. What type of evidence do I need? You need a certificate or some sort of a paperwork that says that you have done that. When should I submit the evidences? So as of this year, you do not need to submit evidences unless you are asked. Okay. So they will assess your application and they will randomly ask evidences from some people and they have to submit the evidences. Okay. So if no one asks for evidences, don't worry about it, leave it. There are 2 stages where they can ask for evidences. Once is after you have submitted your application, they do random audits and ask for evidences to some people. That's one stage. The other stage is after the interview. If the interview panel members have any suspicion of your evidences, they might ask for evidences and then you have to submit them. Okay. I don't have a certificate. Can I claim points for it? You should not. I'm a medical student or intern now. What can I do to prepare for training in the UK now? Or I have just started to work in the UK. I'm going to start working in the UK soon. How should I, like, what should I do now to prepare for the IMT? Sorry, there's a mistake in here. So if you're a medical student, so qualification wise, there is nothing much you can do. You can probably try to do a CCD or CME or something after you graduate and see if that helps. I'm not sure if that does. Quality improvement project, you can try to do some during internship, okay? If that is allowed by your boss in the hospital, your departmental head or someone, you can do that. People have done that before, okay? So you should be able to do that if you try hard enough. Teaching wise, as an intern doctor, you can do some teaching while you were in Bangladesh. So you can do a lot actually. Sorry. That's what you can do as a medical student or intern. So when you are in the UK already, what can you do? So the first thing that you should try to do is start working on getting your CREST form signed. Okay. So you should get in touch with your supervisor directly and let them know that you are going to apply for training and you'll need the CREST form signed. Okay. And ask him what he wants you to do. Sometimes he can directly tell you you'll have to maintain the Horus e-portfolio. And then once you have evidence of everything, I'll sign it off. So if he says that, then it's fine. You know that you have to maintain the Horus e-portfolio, then maintain it and you'll get it signed. Okay. You should also try to talk to other consultants. Any consultant who you have worked with for a duration of at least 3 months can sign off your CREST form. So talk to other people as well. Okay. Whoever gets this signed off for you is fine. So that's all about the IMG application itself. Okay. So you apply for the IMT in like IMT program, and then they are going to assess your application and they will invite you for an interview if you're eligible enough. Now let's talk about the interview, like a very brief discussion. So there are 2 stations in the interview. The first station is the application and suitability for IMT. They will ask you some questions and assess if you are suitable for IMT. And they're also going to ask you an ethical, a professionalism, and a governance question. And the second station is a clinical scenario. Well, they will ask you a clinical question and they will ask you to hand the patient over as well. So station 1 has 2 parts. Part 1 is a 2-minute presentation where you will be allowed to present yourself, present your achievements that you think make you eligible to apply for IMT. And then they will ask you some questions from your CV. Part 2 is the ethical, professionalism, and governance related questions. In the station 2, 2 parts again. First part is the clinical question. Second part is the patient handover. So a bit more details. So station 1, 2-minute presentation I've already told. Give an overview of achievements to date, which are most relevant to your application to be a trainee in internal medicine. I have suggested some preparatory materials here. I'm not going to talk about those at the moment. It is quite overwhelming. So have a look and take a photo if you want. In the second part, they will ask you some questions to assess your suitability. They can ask you, why do you want to get into IMT? What have you done so far to get into IMT? Tell us about your research. Tell us about your publication. Tell us about your teaching experience, etc. Okay, that's the first station. So part 2 of the first station is ethical, professionalism, and governance related questions. So they can ask you an ethical question. They can give you a scenario that's related to medical ethics and ask you to answer the question to assess how well oriented are you to the ethical part of medicine. Then they can ask you some questions related to clinical governance to assess your knowledge of clinical governance. For example, they can ask you, what do you mean by audit? What do you mean by research? What's the difference between audit and research, etc. And there is another category of questions. They can ask you experience. So tell us about a situation where you have dealt with a aggressive patient. Tell us about a mistake that you have done. Tell us about your weakness. Tell us about your strength, etc. So these encompasses the first station. So first part is suitability for IMT, and second part is ethical question. Station 2 have got 2 parts. First part is the clinical scenario. They will give you a clinical scenario. They will give you 3 minutes to prepare your answer, and then they will ask questions from that scenario for like 10 minutes. And they usually ask, how will you assess and manage the patient? What are the investigations you would do? What are the differentials that you would do, etc. And after that, they will give you 1 minute to hand this patient over to a colleague. That's the interview structure. So this is a brief idea of the preparatory materials that you can use. There is a website called MediBuddy, which is a widely used preparatory material for IMT. So you can use that. Optimize Interviews is another amazing website. They have courses as well, which you can do. There's a PDF, there's a book, Medical Interviews, which is very helpful. And you should have idea about medical ethics and stuff like GMC Good Medical Practice. And for the clinical part, you can read any textbook is fine, but people use Oxford Handbook of Clinical Medicine more, so you can have a look at that one, and ALS manual. And bear in mind, it's not the knowledge that is being assessed, it's how you communicate the knowledge. You can know an answer, but if you can't say it out loud, then it does not help. So practice is very important. Now, assessment. How are you assessed in the interview? So there are two examiners in the interview. Each of them are going to assess you on 5 different marks, okay, out of 5. So if they give you 1 for a question, for your answer, that means poor, you are unappointable. If you get 1 in any question, you are not appointable, okay? 2 means there is an area of concern. 3 means it's a satisfactory answer. 4 means it's a good answer. 5 means it's an excellent answer. So you will be assessed based on these on all of your question, okay? So appointability. So to be classified as appointable, you must meet all these criteria. So none of the answers can be marked as 1. So if you get 1 in any answer, you are not appointable, okay? No more than 2 of the 12 interview scores can be 2. Okay, so you can get 2 in maximum of 2 answers. The total interview score must be 16 or above out of 60. And being appointable is not enough because there is a number of IMT positions. Okay, you have to score higher to get an IMT position. So this is the total score. So interview 1, interview 2. So applications and achievements, they will mark you out of 5. Suitability, they'll mark you out of 5. Ethical question, they will mark you both out of 5. Clinical scenario, they will mark you out of 5. Clinical handover, they will mark you out of 5. And there is a separate mark on communication as well. So then they kind of multiply it by 1.2, and this total score is on 80, right? How much score do you need to get the IMT number? So this is the data from when I applied, okay? And the mean and median average was 64.43, okay? So just bear this in mind, that this is a very competitive program, so you'll have to try to aim higher, and being appointable is not enough, okay? So you can see from here, a lot of candidates got full marks, 80 out of 80, okay? Now, how competitive is IMT? So this is a statistical data from the IMT website. In 2024, the competition ratio was 3.69. Okay, so for each IMT position, like 3.69 candidates were there. From 2015, the competition is getting higher, if you can see here. There was 1.70, then 1.53, and now it's 3.69. So it's going to be even more competitive next year. Okay. Compared to other specialties, however, it's not as much competitive. For example, if you want to apply for cardiothoracic surgery, you have a competition ratio of 45.33. So 45 candidates are applying for 1 post. Okay. If you want to apply for GP and public health, 112 candidates are applying for 1 post. So compared to that, IMT is probably one of the least competitive ones here, okay? But again, it's getting more and more higher gradually, so bear this in mind. Another important thing is number of people applying for internal medicine training is also increasing day by day. So this is the graph left side is taken from Reddit. If you can see here, so from 2018 to 2023, the applicant number is getting more and more higher, and the fill rates are almost 100%. So in 2023, 99.6% positions were filled. So there were total 1,600 positions and 1,500, like 1,595 people accepted. So only like 5 of them declined their position. So it's very competitive overall. Now, frequently asked questions on the interview. When should I start preparing for the interview? You can start preparing for the interview after you apply. That's okay. There's nothing that you have to do now actively, but there are a lot of passive things that you can do. For example, every time you see a patient, when you come back home, revise the clinical condition from a book or read the guidelines. Okay, this is going to be helpful long term. And when you're handing over a patient to a colleague, try using the SBARD method from the ALS handbook. Work on your English. Fluency matters. The accent does not. And there is a mark in communication, so you'll have to have good fluency in English. Start preparing early. So when I say start preparing early, I mean when you apply, that's what I mean, not like from now, okay? And practice is the most important thing. Is it mandatory to attend a preparatory course? It's not mandatory, okay? Should I prepare? Sorry, there's a mistake here again. Should I attend a preparatory course? Yes, you should probably. Yes, I would recommend to attend a preparatory course. I think I have come to the end of my slide. This is the last slide. So for more information, you always have your friend Google, search whatever you need, you'll find the information. For official information on IMT, there is this website, imtrecruitment.org.uk. That's the official website. Have a look at those. Roadtouk.com. So we are very fortunate to have Road to UK. These are 2 of our seniors from Mymensingh Medical College. They have founded this website. This is an amazing piece of work that they have done. So you have all the information that you need, and it's constantly being updated. Have a look at the website, and you'll find everything. There are 2 very helpful Facebook groups. One is PLAB for Bangladeshi doctors. You will find a lot of information on that group. You can ask your queries and people will try to help. And the other one is International Medical Graduates in the UK. This is a very large group of doctors who are working in the UK or are willing to work in the UK at some point. You can be in that group, you can ask questions and stuff. And use LinkedIn if you don't. This is very helpful. You will find a lot of professional stuff in LinkedIn, which are helpful. Attend conferences if you're in the UK. Attend conferences. When you go to conferences, you meet a lot of people and you get opportunities to learn what other people are doing in their field, and you get to do a lot of networking as well, which is good, right? And I have a website. This is facilization.com where I write. Have a look if there's anything that you think I can help you with. Send me an email and I will try to help. I think that's all I had to say. I will share my screen now, and if you have any questions, please feel free to ask or get in touch. Thank you very much.
Thank you, Dr. Faisal, for your very helpful presentation. And I would now like to give the floor to Dr. Parmita Das for conducting the session of the later session. And if you have any question, like our co-moderators, Dr. Faria Rashid or Dr. Maisha Shabnam, you're feel free to ask.
You, Dr. Sadia Tasnim, for giving me the floor. And I would like to thank Dr. Faisal Abdullah for providing us an excellent presentation, I must say, covering all the details about the road to IMT. And it was really fruitful, and I believe that would help a lot of Bangladeshi people, Bangladeshi students to get to the IMT training in UK. So I think it's a bit quite challenging for us to get a training post in the UK and USA, and most of the students don't get the proper guidance about the training, how to apply, how to get there. So your presentation was really fruitful and insightful today. and I believe everyone will be get benefited from that. And now I would like to go to our question and answer part of the webinar. Whoever have a question, you can just leave leave the question in the comment box, and we will address it to Dr. Faisal Abdullah. And if Dr. Faria and Dr. Maisha have any question, you can also ask. And I have a question from myself also. Before going to the question and answer part, I would like to remind if our Dream Assembly has ongoing step 1 and step 2 batch. So if any students from Bangladesh, if anyone is interested in our batches, or anyone needs help or guidance, just contact Dream Assembly or Dr. Abdullah Al Masood for any further informations. And now I'll go to our question and answer part. We have some question in our comment box in the Facebook Live. So from the first question is there any time barrier for becoming an IMT trainee? Dr. Faisal Abdullah, can you please give us a suggestion?
Sorry, can you say again? Sorry, I missed that part.
Yeah, so definitely. So the first question is asked by Dr. Asif Shaun is there any time barrier for becoming IMT trainee?
So what I understand is he's asking if there is any time limit, as in when he can apply. No, there's not. So your age does not matter. Your year of graduation does not matter. These are not taken into account. Okay, so you can apply whenever you want. Whenever you feel you're ready, you can apply. That's fine.
Okay. And another question he have is how can I sign CREST form from UK consultant, as they mentioned at least 3 months working time is required?
Yes, so you have to work here for at least 3 months, and then you can ask them if they can sign it for you. So the best thing to do is, before you start working, let's say on your first week of working as a doctor in the UK, you speak to the consultants and let them know that you want to apply for training later in that year. So you are looking forward to get the form signed. Okay, let them know so that they can think about it. And after you have finished 3 months, speak to them again and they should get it signed. Okay, so if you are working as an observer, if you're working as a clinical attachment doctor, you cannot get it signed then. You have to be employed to get it signed. Okay, however, if you're not working in the UK, you can still get it signed by a consultant from back home. Okay, that's a different discussion. I would not recommend starting as a trainee directly without any prior experience of working in the NHS, but theoretically, yes, you can do that.
Okay. So I have a question on that. Would you suggest any Bangladeshi students who are not residing in the UK and did not get any opportunity to work in the UK, how can they approach to this CREST form, or how can they get the working position in the UK?
Fine. Okay. So in order to work in the UK, you need to have GMC registration. Okay.
Okay.
So there are multiple ways to get GMC registration. One is the PLAB, which has recently been replaced by the UKMLA. So you have to finish the PLAB or the UKMLA, apply for GMC registration, search for jobs. Okay. Get a job, start working in the UK, and then get it signed. That's one way. The other way is the membership exams. You can get MRCPs and stuff done, and you can also get registration by that. That's another way. However, if you're not working in the UK, you have to talk to someone in Bangladesh, a consultant, a specialist, who you have worked with for at least 3 months in the last 3.5 years, and you can ask them to sign for it. But
Okay.
I would never suggest anyone to start directly into a training post. This is very challenging and has a lot of kind of might have a lot of bad consequences as well if you're not oriented to the system.
Okay, great to know that. So let's move to the next question we have in the live session. I am currently residing in the UK and pursuing an MREs in public health. I have only 12 months of clinical experience in Bangladesh. Will that experience be enough for me, or will completing MRCP be mandatory within the first 2 years of starting the IMT? When would be the best time for me to apply for the IMT?
Okay, so theoretically, you can still apply for IMT now, okay? But before you start the IMT, you need to have GMC registration and you need to have 24 months of experience, okay? So if you are still not working, you probably will not be able to fulfill these two criteria, so it's going to be difficult. So you need to achieve GMC registration first, either by doing PLAB or UKMLA or by doing MRCP. Once you have GMC registration, you can start working in the UK and then you can get your crest signed and apply for IMT. Regarding MRCP, so if you have done MRCP before starting IMT, then you've already fulfilled one of the criteria, which is MRCP. You don't have to do it again, right? However, if you don't have MRCP, which is usually the case, then you have to finish MRCP by the first 2 years. I hope that answers the question. Can you please ask if that's clear enough?
Yes, I think it covers all the questions that was asked by Lima. So she asked, will completing the MRCP be mandatory within the first 2 years of starting IMT?
Yes, that is a mandatory thing. Yes, MRCP must be completed within the first 2 years. Yes.
Okay, that's great. And let's go on to the next question. We have another question that where can I get the teaching observation form from? I searched in Google, I could not find it.
1 second. Let me show you. Let me see if I can find it. Just a second. Yeah,
Sure,
it
take
does.
it.
It's the first link that comes up when you search. It's there.
Could you please share that
Yes.
with us so then everybody can get it?
1 second. Do you want me to share my screen or just share the form with you?
Whichever is the easy for you, or
Oh,
yeah,
okay.
you can share the screen and
That's
whoever
fine.
wants, yeah.
Yeah, let's share the screen. So can you see the screen now?
Yes, we can see it.
Fine. So I am in Google now. So
Mhm.
I've searched with teaching observations form. And this is the first form that comes up, yeah? Teaching observations form. And this is the form, basically. I've downloaded it. This is the form. This is what the form looks like. Okay, that's it.
Okay. So next question is, I have GMC registration through PLAB. My clinical experience includes working as family physician, medical officer. I have done only one conferences and one publication in a Bangladeshi medical journal. How can I ensure a job in NHS? Should I give the MRCP, MSRA? Should I directly apply for the IMT? I am completely clueless. It has been a year. I did not find a job.
Okay, all right. So you're asking about your first job in the NHS. So yes, this has been very challenging over the last few years, actually getting more and more competitive to get your first job. Um, so you, so one of the ways is to directly apply for training, which is something that you can do, but I personally would not recommend doing that. What I would recommend you is try to work on yourself, to work on your profile so that you increase the chances of getting shortlisted for a job. So have a look at the criteria. So one of the criteria is qualification. So what can you improve in terms of qualification? Okay, so you can attend a membership exam. If you know which specialty you want to pursue, you can do that. If you want to pursue medicine, you can sit for MRCP Part 1 and maybe even Part 2. That's gonna make your CV better, and then that should be helpful. If you want to be a surgeon instead, you should apply for MRCS Part A. If you want to do emergency medicine, then do MRCEM Part A. That's one thing. Then courses. Attend the course that increases the chances of getting shortlisted for a job. One of the most important ones is Advanced Life Support by Resuscitation Council UK or European Resuscitation Council. try to attend either of these. This should be helpful. There are other courses as well, but this is the most important part. Then whenever you apply for a job, make sure that you have something in your application that shows that you're interested in that job. For example, you can do some e-learnings. Let's say you're applying for a job in geriatric medicine. Do some e-learning in geriatric medicine and put it in your CV so that it looks good that yes, you have done some e-learning on geriatric medicine. You're interested in that. Do a course on teaching, do a course on research. This should be helpful. Nothing guarantees a job, okay? Not even PLAB, not even MRCP. So no one can guarantee that if you do this, you'll get a job. So these are the things that you can do to increase your chances of getting a job. So qualification courses, then clinical audit or quality improvement projects. So try to do one and then present the same thing in a conference. You'll have a bit more of that. You've said that you have a publication in a local journal, so try to do something and publish that in an international, as in a PubMed cited journal. That should be helpful. Okay. When you're applying for jobs, make sure you're applying it right. Okay. What I mean is, don't just apply for the sake of applying. Okay. Take your time. Read the application properly and make sure you present yourself well. Okay. That's my say in terms of what you can do to increase your chances of getting a job. And I've already said that I don't actually recommend starting directly as a trainee. You can definitely do that if you want, but I would probably not recommend that. One of the other things that most people, like a lot of the people, don't really care. I mean, not care, as in a lot of the people I've met don't actually apply for enough number of jobs. Okay, so I'm not sure how many jobs have you applied so far. Make sure that you're applying a lot because that increases the chances of getting shortlisted. So my suggestion is at least 5 job applications a day. That would give you 150 applications a month. So see if you're applying enough. So if you're applying less than 150 a month, you're not applying enough, to my understanding. Okay. I hope this answers. I understand this is very challenging actually. But yeah, try to do all these things and then hopefully this will help. And also, I haven't mentioned this, clinical attachments can help sometimes. Okay. If you haven't done one, consider doing one. And if you are planning to do a clinical attachment, and then try to talk to people who have done clinical attachments previously and see if that helped them. Sometimes you can get some insight by talking to people that might be helpful for you. Okay, thank you.
Yeah, thank you, Dr. Faisal Abdullah, for addressing all the questions. I had all the question addressed in our comment box. So I just wanted to ask you one question: that how was your transition into IMT from the Bangladeshi doctor to getting into the IMT? How was was that challenging as a IMT, or what challenges did you face when you started the IMT?
Okay, so yes, in one word, it was challenging. It becomes particularly a bit more challenging when the hospital where you work, when there are not a lot of international doctors in that hospital. So my first workplace, where I'm still working, by the way, is a hospital where there were a lot of international doctors when I joined. So it was quite challenging, I would say. But it takes time for you to get used to everything, okay? And a lot of patience and a lot of events as well. When I say events, I mean you learn as you have more experience, okay? Yeah, I think I don't have anything specific in here that I can say. I would probably say if I had to go back and do it all over again, I would probably try to talk to people a bit more. Okay, so when I first started, if I was confused about something, I would not say it out loud. I would just probably stay quiet and come back home and try to see what I did wrong. Okay, so I would probably suggest if international doctors, if we try to talk to people and um, say things to our colleagues and say things to our seniors, they can sometimes help. Okay.
Okay. Yeah, that sounds great. And I realized that it's a quite challenging process and pathway to get the IMT training. And both in the UK and USA, it's a very challenging situation. And we have to just stick to our goal to get the position. And we have to try getting us better and better and make our CV more nice and more experienced. So yeah, so all people, all students know about the exams, and all students know about how to get through the exams, but it's a bit quite challenging to get your CV enriched. So I think, but beside the exam preparation, we should start preparing our CV to be enriched, and that's I found in your presentation today how to get enriched in our CV if any students wanted to pursue a medical career or IMT training in the UK, and we are at the end of our webinar today. If anybody has any questions, just leave us a comment in the Facebook Live. And if you have any question, Dr. Sadia, Dr. Faria, and Dr. Maisha, you can ask Dr. Faisal Abdullah, and we can get our answer in by the way.
I think you have covered everything beautifully, and we have got all of our answers.
Right. So everything was in the presentation, and it was nicely presented and explained in a details way. So I think he covered all the things. And still, if anybody have some questions, just let us know, and we will try to get through this question with our panelists, and we will try to address them later. So it's time to wrap up our webinar today. Thank you all for joining us today, and thank you all the moderators, my co-moderators, for joining us today. And I must thank Dr. Faisal Abdullah for giving us time today, for the beautiful presentation and for the insightful webinar today. And also, I'd like to thank Dr. Abdullah Al Masud for arranging such a webinar that is helping the Bangladeshi students a lot. And we are having this kind of webinars every week on Saturday and Sunday, on career webinars on different situations and different topics. Just keep an eye on the Facebook group and page of Dream USMLE for the updates. And thank you all for joining us today.
Thank you very much.
Thank you.